Hi, my name's Peter. I'm one of the academic staff members in the Postgraduate Studies for Wound Care, and I'm joined by Adriana Tiziani, our course director.
Hi.
So today we are going to run through Doppler assessment. So Doppler is a really great tool to use as a wound practitioner, regardless of your background, whether you're a nurse, an OT, a pharmacist, a podiatrist, or a doctor. It's a good way to determine the vascularity of the lower limb. So many of our different wounds have some kind of vascular component, so it can be a very useful tool. We use it in combination with other tests like ankle brachial indexes or toe brachial indexes. So today we'll run you through good technique and the basics of interpreting the output from your Doppler. Okay, so the first pulse I'm going to examine is the dorsalis pedis pulse. It's located on the top of the foot, around the middle section of the foot. So I've already palpated that with my fingers and found that it was present. So now I'm going to put my Doppler in the gel. So I've put lots of gel on, as you can see, and I'm going to try and find a signal. So I can hear a clearly biphasic or two sounds. 1, 2, 1, 2, 1, 2. And I'm also listening and looking at the same time. So the next pulse we will have a look at will be the posterior tibial artery, which is located just behind the medial malleolus. So what I'm going to do is put my Doppler gel. So again, using lots of Doppler gel and just making sure the foot's nice and relaxed. Okay, yep. The patient will inevitably try and pull their foot up to help you, but the foot should be relaxed. So that whooshing sound you can hear there is a vein. So see when I give the foot a squeeze, you can hear the vein. So we know that the artery is located right next door. So if I just move over a little bit, I'll be able to hear the artery. And that pulse has 3 sounds. So 1, 2, 3, 1, 2, 3. So one thing to remember when you're using the Doppler on your patients is sometimes it can be very difficult to locate the pulse, especially when you've got lots of edema or adipose tissue, remembering that these vessels can be just a few millimeters in diameter. So one technique that's helpful, I find, is using like a snake or an S-shape approach across the top of the foot. So you might decide to start higher up if you're having trouble, and you just anchor your hand to the foot and draw an S shape. Adriana's got lovely pulses which are easy to find, but you just draw across, up and down and over, and eventually you'll run into the pulse. Okay, so similarly, these ones, the posterior tibial arteries, can be difficult as well, particularly when you've got lots of edema. So it is handy to anchor your hand to the foot or to the heel just to make sure you've got a good grip on the Doppler and lots of control. So we use a pencil style grip. You can see how I'm holding it like a pencil, which gives you a good amount of control. The other thing is to just make sure when you do find a signal that your angle is correct. So you can see if I have my angle too sharp, I can't hear the sound anymore. If I just lower the angle to more of a 40 to 60 degrees, now I've lost it, and just take the time to optimize the signal. So it can be just very small movements. I've got a triphasic signal, so 3 sounds, which is ideal. So it's very easy to make a good waveform sound bad with poor technique. So it's very important to get those angles correct. Okay.